Hi all, I hope you're having a good day. We're going to talk about bring-ups. So what is a bring-up? A bring-up is a way of checking in with a patient to see how they're going. It's about answering questions, it's about getting an update, it's about checking in to see how they're progressing, and also trying to reactivate them back into care. Bring-ups are super powerful, and if done effectively, you can really sustain, build, maintain a practice just by calling. Chiropractic calling bring-ups is a lot more effective than CAs. Why? Patients typically listen more to their chiros. Chiropractors command more attention. We've got more authority, and usually you've got more of a relationship, and there's more trust in that case. In terms of frequency, doing bring-ups every week is what I did all throughout my career. It's what I recommend. I know you sent bring-up lists each month. That should be the minimum. Ideal period should be 1 to 2 weeks. You can ask your CAs or your area managers to print bring-ups. I know many of our chiros prepare their own bring-up lists. It's something you should speak to your area leader more about. In terms of when to call bring-ups, the sooner the better. Patient drops out of care or they miss an appointment, you should be personally jumping on the phone, just checking in with them. Hey Mary, everything all right? We missed you at your appointment tonight. Oh, look, I just forgot. Okay, I understand. I'm here till 7. Can you get down? That shows a couple things, that technique. Number 1, you show you care. Number 2, I understand. You don't use language like, oh, no worries, that gives the wrong message. It gives the message that they can do this anytime they want. People usually feel bad about missing an appointment, so just saying I understand is an acknowledgement enough. It's important to also say, is everything okay? Because sometimes people have a legitimate reason. There's a death in the family, someone's sick, there's been an accident, so it's important to slow it down, acknowledge, ask. In terms of getting a CA to help, that is an option. I really would encourage chiropractors doing it themselves is the most effective strategy time and time again. If, however, you're too busy with patients, or you're not confident, sitting with your CA with a list, sitting next to each other, having the phone, you dial the phone number, getting your CA to call is another option. It's really, that's something that I did only when I was super busy and really just didn't have time to do it, and I needed a bit of motivation. In terms of techniques, just be direct and be caring. The fact that you're calling is 70% of it, and then 70%. And at some point you're actually going to say, hey Mary, ring. It's Robbie, the chiropractor. Just checking in. Look, I missed you at your appointment this week. Is everything all right? Yeah, I've totally forgot. Understand. Well, look, I'm here this week until each day until 7 o'clock. Can I help you later in the week? And then patients will, you'll be able to sense if the patient's interested. If you're getting pushed away, I encourage you not to, let's not be overly needy, or if you chase them super hard, just acknowledge them. Okay, I understand, Mary. Well, look, we're here if you need us. I'll leave you to it. Thanks a lot. So there's some tips. If you get any questions, speak to either myself or speak to your area manager. We're here to help. Speak to you soon.